Are you feeling excessively tired after your stroke? Feeling more tired than you normally would after doing a simple task or activity? I mean, a deep in your bones exhaustion that seems to keep coming back regardless of how much you sleep? Well, it has a name. And even though it's something a lot of stroke survivors experience, it's not really talked about very much. Even in rehab settings, when you're surrounded by therapists and doctors, it's called neurofatigue. It's described as an extreme mental and physical exhaustion, which happens because your brain is in what I like to call repair mode. It's working overtime to not only repair and recover from the damage caused by the stroke, but your brain is also still having to carry out all the normal day to day functions our brains are responsible for. So after a stroke, your brain is just having to work much, much harder to do things it used to do without much effort at all. The analogy I sometimes like to use is what happens to some of us after eating like a really, really large meal, and we start to feel all like sluggish and sleepy because our body has to pull energy and resources and blood flow from other parts of the body to support our GI tract as it works to kind of digest and break down that large meal we just ate. Or what some women experience during that first trimester of pregnancy, when you feel tired and exhausted all the time because your body is having to use all its energy and resources to help grow the developing baby. But after a stroke, your brain is literally trying to rebuild connections, reroute pathways, relearn movements, how to process information differently, and how to compensate for areas in the brain that were injured by the stroke. And all of that just takes such a huge amount of energy. This is what causes neurofatigue. So if you find yourself thinking, why am I so tired all of the time? Or why am I so worn out after doing the simplest things? You are definitely not alone in feeling this way. Like I said, it's not something that gets talked about or explained enough. And because of that, it can make you feel like it's just you who feels this way. Or you may start to wonder if something is actually wrong with you, or question if maybe like some form of depression is setting in. And because neurofatigue is one of those like invisible conditions that can happen after stroke, the people around you may not understand what's really going on with you. And we all know that when people don't understand something but offer their advice anyway, they can say some really unhelpful things like, you need to work hard if you want to get better, or suck it up, push through, or you look fine, or you're just not sleeping enough, or like, are you depressed? Now, while depression is a hugely common, it's really common after stroke, and it can affect up to like a third of stroke survivors. Neurofatigue is something different. So if after learning about the ins and outs of neurofatigue, you suspect that depression might actually be something that you're experiencing, please seek guidance and support from your doctor or a licensed mental health professional, okay? With neurofatigue specifically, you may experience just that an overwhelming feeling of exhaustion, feeling just completely wiped out or out after like your workout or your therapy, or just completely drained after like social interactions with family or friends. Though families can often make us feel this way even before a stroke, but feeling mentally drained, burned out, and just kind of like maybe having difficulty concentrating, or just an all encompassing physical fatigue throughout your body. This is neurofatigue. The hallmark piece here is that much of this deep fatigue and tiredness is usually felt just after a short period of physical activity, doing something seemingly simple, or even after like a short social interaction or conversation. But again, behind the scenes, on the inside, your brain is working overtime around the clock. And again, this is because the brain is just trying to heal and repair. It's trying to reorganize itself after the stroke. And the process of all of that just requires just an enormous amount of energy. So, in addition to your brain overseeing this whole repair and recovery process, you're just using more energy in general, to move your body, to balance, to walk, to coordinate your movements, to talk and form speech, to think and process information, concentrate on a task and try to learn and keep up with all the new concepts and information that gets thrown at you after a stroke, especially in the beginning. I mean, it's enough to make you tired just thinking about it all, right? So here's the big question: how long does neurofatigue last? Like most things after stroke, it's going to be different for everyone. Like for neurofatigue, for some, it gets a lot better over the course of like maybe the first several months after the stroke. But for others, some level of neurofatigue can persist and continue for much longer, especially if you're still dealing with like significant physical, cognitive, and emotional challenges and limitations after your stroke. But there are several things you can learn to better manage neurofatigue over time. So, what can you do? Number one, pace yourself. This is huge. A lot of people have a tendency to push really hard on those days that they feel good and then completely crash right after. So instead of pushing yourself until you're completely exhausted, try building in short rest breaks throughout the day before you hit that wall and are completely wiped out. Now, energy conservation is a big area for us OTs because conserving your energy for those tasks and activities that are the most important to you will have a big impact on your day-to-day quality of life. So conserving your energy means knowing what part of the day do you tend to have the most energy, and then do certain high energy tasks at those times, or sit to do tasks whenever possible. Break tasks up into smaller steps or spread them out versus trying to do everything in a short amount of time. Plan ahead, prepare for as many things as possible in advance, and prioritize, meaning get real clear about what things you absolutely need to do, what things can wait, tomorrow's another day, and what things you can maybe delegate and ask someone else to help you with. Now, none of this is easy, and asking others for help sometimes is the hardest part of all. But something I share with some of my patients who really struggle with this is this: if you have people in your inner circle who are ready and willing to help, it actually makes them feel good to have something concrete and specific that they can go and do for you. Again, it makes them feel good to be able to help. So let them help, okay? Number two, prioritize your sleep. Sleep is incredibly important for brain recovery, healing, energy restoration, all of that. It is also important to take naps if and when you can, or sit and take breaks if you start to feel that heavy feeling of fatigue settling in. Number three, reduce overstimulation whenever possible, because for some people after stroke, too much noise, attempting to multitask, busy environments, screens, constant activity can make your neurofatigue exponentially worse. And with this, I include the recommendation to limit your interactions with high energy need draining people. You all know the kind of people I'm talking about. Just thinking about seeing them or having a conversation with them can make you already feel tired. Right now, they are not your priority, even if it's your family. You absolutely have to be fiercely protective of your time and energy now more than ever. Okay. And number five, always listen to your body. Fatigue is information. Sometimes your brain is telling you, hey, look, I need a break. And that's okay. That does not mean you're lazy. That does not mean you're failing. And it definitely does not mean your recovery isn't happening. Just remember, your brain is working overtime behind the scenes while still helping to carry out as many of your normal day-to-day functions. So please be kind and patient with yourself, and give some of the strategies I mentioned to try. Okay, as always, I really hope this was helpful. And if any of you have experienced anything like neurofatigue, or you think maybe like neurofatigue, let me know in the comments. Let me know what things kind of tend to make your fatigue worse, and maybe what things you may have figured out already that seem to help. Okay, I hope this was helpful, guys, and I will see you next time. If you found this video helpful, don't forget to subscribe for more DIY videos to help you along the way in your stroke recovery. Struggling at home? Have a question? Leave me a comment. I'm here to help.